Hi, my name's Fiona Adam. I'm a medicine specialist. I work at North Downs Specialist Referrals in Surrey. In this session, we're aiming to provide a medical refresher. We're going to look at problem-solving approaches to PUPD and diarrhea and pyrexia of unknown origin, and provide updates on hyperthyroidism and chronic kidney disease. I hope you find them useful. Hopefully this is a pattern everyone is happy with, I'm guessing. So 10-year-old female entire, the clue is female entire, crossbreed dog, just not quite right, owner's very vague. And there's a little history for you there, and there's a snippet of the physical exam. Does anyone want to be so bold as to suggest a diagnosis? Okay, so it's going to be a pio, right? It's really pretty obvious. It'd be very surprising if it was something else. So this is a pattern that we all recognize, okay? Pattern recognition is not a bad thing. We do it all the time. It's quick, it's easy. The client thinks you're a genius, and you can go straight to the problem. You're not faffing around doing tests that you don't need to do. And we pattern recognize all the time. Like, when you see the 17-year-old boy with the baked bean exhaust cans and the Vauxhall Corsa comes speeding around the corner, that you're not going to cross the road in front of them. And we pattern recognize all the time, and there's nothing wrong with it, okay? So please don't take from this lecture that pattern recognition is not okay. Sometimes it just doesn't work though, and that's when we need to have this problem-solving approach to resort to, okay? So here's another case for you. So 8-year-old dog that presents for weight gain, increased appetite and increased thirst. Also been panting more. The dog seems well, he's not unwell, he's just annoying the owner with the panting and the drinking. He's put on a bit of weight, and the dog had an echo a number of months ago where the hair hasn't regrown. So if this came into your consult room, what would your first thoughts be? Yeah, seems like a fairly likely scenario, doesn't it? So these are both cases, the Pio and the Cushing's dog are both examples of patterns that we see regularly. We're all familiar with them. We'd be able to make a good guess. But pattern recognition relies on experience and familiarity. And prevalence is really important in pattern recognition. So Pios and Cushing's are something that we see often. So they're patterns that we're familiar with. And they're also quite common patterns. So when you see them, you feel reasonably confident recognizing them and saying, well, Cushing's and Pios are both pretty common, so I'm pretty happy with my guess. And when we see a dog with PUPD, panting, slow, some weight gain, alopecia, etc., it probably is something straightforward, but it might not be, okay? So when we see cases, we need to recognize when it fits and when it doesn't fit. And if the pattern doesn't fit, it's important that we don't try to make it fit. So with the Cushionoid dog that we saw a moment ago, the owner said to us, actually he's not eating well at all and he's vomiting all the time. Cushing's has to go right off the list, right? Cushing's dogs are not unwell. It doesn't cause vomiting. Either there's a comorbidity or this is not Cushing's. So we need to recognize when that pattern isn't quite right. Sometimes pattern recognition is going to fall into some problems. So this is a 6-month-old male entire German Shepherd that presented for, the owner's main issues were that it had a poor hair coat. One of my main issues would be it's about the size of a box of gloves, but they weren't as concerned about that. So there's some pictures there. So you can see the dog's 6 months old. There's some alopecia on the hocks. The hair coat is very poor. The dog's very small. It's got retained deciduous dentition. Anyone got any guesses as to what's wrong with this chap? This is a pituitary dwarf. So German Shepherds are a commonly affected breed. This is how they look, la la la. This is a pattern that I can recognize, but my horses are your zebras. So my patterns are a bit different than yours. And unless you happen to have seen one of these before or just happen to have read it in a book, there's not going to be a pattern that you're going to recognize. These are all obnoxious cases, just to prove the point, by the way. So this is a 7-year-old recently rehomed ex-racing greyhound that presented for lethargy. And on examination, the dog had contusions, which you can see there on the leg and the ear, and gynecomastia, so the swellings on the ventral abdomen are mammary tissue producing milk. Any wild guesses? So this is a dog that you can just see the scrotum there. This is a racing greyhound, so there's no history. And this dog came allegedly as having been neutered, but in fact, this dog had not been neutered, and this was a testicle in the abdomen. That's a Sertoli cell tumour. The Sertoli cell tumour has produced oestrogen, suppressed the bone marrow, the dog's pancytopenic, and it's got gynecomastia. Now, this is not a pattern that you are ever going to likely be able to jump to, right? But if you can start off with recognising the problems, the dog's got contusions, why could it have contusions? Is it thrombocytopenic? Yes, it's thrombocytopenic. What could cause thrombocytopenia? And work forward from there, you've got a much better chance of reaching the answer. So by having a problem-solving approach, we'll probably get to the end, but that's probably not a pattern you're going to come across very often in your career, fortunately.